Now, if you could just point with, you know, one finger or your thumb, whichever's easier, where the pain is.
Right in here, and it's coming off to here.
Okay. More on the left this time.
Yes.
Okay.
My name's Ken Davies. I've been having pain in my lumbar area. My lower back has been bothering me. Over the last month, it really increased. And then I golfed yesterday just before the procedure to get out, and just really it's kind of aggravated me, and it's gone to the sides, the pain.
And is there any pain going down into the buttocks here?
Just it finishes up right here.
Okay, but it's not going down here.
It's not.
Okay. It's not going into the groin.
Nope.
It's not going into the groin in the front.
No. And I was actually lifting stuff out of a car.
Okay.
And I was like leaning over and pulling stuff out of a car, and I felt my back kind of really spasm and stuff. But over the years, through football, I'd have some back pain, but nothing that would really slow me up. Every once in a while, you'll have some spasms and get off your feet, ice, heat, and your body would just kind of get better and continue on. But I would say over the last 5 years, more particularly, I've had just bouts of it for a month or two.
Okay. Is there any pain on the hip bones in the front?
No.
Okay. Is there any trouble with your urination?
No.
Okay. Any problem moving your bowels?
No.
Okay. Is there any numbness or anything down here?
No.
Okay. Good.
So for a long time, I had pain and had like real pain into my shoulder blade. Almost feel like a knife was being stabbed back there, right behind the left shoulder blade, and always like trying to move and loosen it up, and just pain to the point where I started I had pins and needles into my fingers and down my legs. Started getting weakness in my hands and even down my legs. So and it was over years. They take MRIs and do physical therapy, and things would make it feel a little bit better, but it'd always come back. So we did a disectomy and put in the bone graft and a plate in here, and it worked.
Good.
But since then, which happens with those kind of surgeries, below it caused a bulge.
Okay. Well, the reason that that's an important part of your history is that people who have had one disc problem can have more than one disc problem. So it's possible that your low back problem is related to a disc. You also have another thing that we noticed on your MRI, which is called sacralization of your lumbar joint. So basically your anatomy is a little bit different than normal, but it's still something that I think we can help with injection therapy, because I think a lot of this is coming from the facets, and we're going to inject along the lamina and the facets. Okay, we don't inject the nerves. That doesn't help. And then we're going to inject your sacroiliac joints also. And I think that, in your case, is really important because of your unique anatomy. Many times, lumbar back pain, low back pain, is related to the sacroiliac joint. So, since I was originally trained as a prolotherapist, that's one of the things that we will definitely treat. And I think it makes a big difference because we treat all of those ligaments in that area,
Right,
and tighten it up and get it back to a normal function if we can. Well, we are just after your procedure. How do you feel now, Ken?
I feel a little sore, but I feel great. I'm super optimistic and excited. I think that's the best feeling of all. Is I'm glad to be done it, and I'm looking forward to the process of healing. The doctor and Steve and Jeremy were great. They were very attentive, but the procedure was uncomfortable in some areas. But I would do it again if everything works out the way it's supposed to.